Can a cancer patient develop dangerous bleeding even from a small injury after chemotherapy? And why do oncologists carefully monitor platelet counts before every chemo cycle? So let's understand a very important concept called thrombocytopenia. Thrombocytopenia means a decrease in number of platelets in the blood. Platelets are tiny blood cells that help stop bleeding by forming blood clots whenever a blood vessel is injured. So in simple words, platelets act like the body's natural bandage system. Without enough platelets, even minor injuries can result in prolonged bleeding. Chemotherapy target rapidly dividing cells. Unfortunately, it does not only affect cancer cells but also affect healthy cells in the bone marrow where blood cells are produced. Inside the bone marrow are called large cells called megakaryocytes which produce platelets. And when chemotherapy suppress the bone marrow, megakaryocytes produce fewer platelets, causing the platelets count to drop. And this condition is called chemotherapy induced thrombocytopenia. Normally, platelet counts range between 1,50,000 to 4 lakh platelets per microliter of blood. When platelets levels start falling, doctors closely monitor the patient for bleeding complications. So, platelets below 1 lakh, this is generally considered chemotherapy induced thrombocytopenia. And at this stage, doctor begin monitoring blood counts more carefully. Platelets below 50,000, patient may experience easy bruising, so risk of bleeding becomes significant. Platelets below 20,000, this is considered a medical emergency. Spontaneous bleeding can occur even without energy. And serious bleeding may occur in brain, lungs, gastrointestinal tract, and this level require immediate medical attention and often platelet transfusion. Some symptoms of thrombocytopenias are easy bruising, tiny red or purple spots, nosebleed, bleeding gums. Before every chemotherapy cycle, doctor check blood counts. Most chemotherapy regimens require platelets count to be above 1 lakh before treatment can proceed safely. So if platelets are too low, chemotherapy may be delayed. The dose may be reduced. Platelet transfusion may be given if necessary, and this helps prevent serious bleeding complications. So, when a blood vessel is damaged, platelets rush to the site and seal the leak. If they are not enough repair workers, bleeding becomes difficult to control. So, thrombocytopenia means a low platelet count, most commonly seen after chemotherapy due to bone marrow suppression. And the lower the platelet count, the higher the risk of bleeding. That's why monitoring platelets is a critical part of cancer.